Question 1. Karina, a client with myasthenia gravis, is to receive immunosuppressive therapy. The nurse understands that this therapy is effective because it A. promotes the removal of antibodies that impair the transmission of impulses. B. stimulates the production of acetylcholine at the neuromuscular junction. C. decreases the production of autoantibodies that attack the acetylcholine receptors. D. inhibits the breakdown of acetylcholine at the neuromuscular junction. Correct answer: C. decreases the production of autoantibodies that attack the acetylcholine receptors. Question 1 Explanation: Steroids decrease the body's immune response, thus decreasing the production of antibodies that attack the acetylcholine receptors at the neuromuscular junction. Immunotherapy is used to upregulate or downregulate the immune system to achieve a therapeutic effect in immunological-mediated disorders including immunodeficiencies, hypersensitivity reactions, autoimmune diseases, tissue and organ transplantations, malignancies, inflammatory disorders, infectious diseases, and any other disease, where immunotherapy can improve the quality and life expectancy. Question 2. A female client is receiving IV Mannitol. An assessment specific to safe administration of the said drug is: A. Vital signs Q4H. B. Weighing daily. C. Urine output hourly. D. Level of consciousness Q4H. Correct answer: C. Urine output hourly. Question 2 Explanation: The osmotic diuretic mannitol is contraindicated in the presence of inadequate renal function or heart failure because it increases the intravascular volume that must be filtered and excreted by the kidney. Urine output also requires monitoring. Failure for urine output to increase after administration of mannitol should prompt cessation of mannitol and evaluation for possible renal or genitourinary issues. Question 3. Patricia, a 20-year-old college student with diabetes mellitus, requests additional information about the advantages of using a pen-like insulin delivery device. The nurse explains that the advantages of these devices over syringes include: A. Accurate dose delivery. B. Shorter injection time. C. Lower cost with reusable insulin cartridges. D. Use of a smaller gauge needle. Correct answer: A. Accurate dose delivery. Question 3 Explanation: These devices are more accurate because they are easy to use and have improved adherence to insulin regimens by young people because the medication can be administered discreetly. Once in use, most insulin analog vials, cartridges, and pre-filled pens must be discarded after 28 days. This means that many patients who use a 10 ml vial end up either wasting insulin or using insulin beyond its recommended discard date. This is rarely a problem for patients using either a 3 ml pre-filled pen or a reusable pen containing a 3 ml insulin cartridge. Question 4. A male client's left tibia was fractured in an automobile accident, and a cast is applied. To assess for damage to major blood vessels from the fractured tibia, the nurse in charge should monitor the client for: A. Swelling of the left thigh. B. Increased skin temperature of the foot. C. Prolonged reperfusion of the toes after blanching. D. Increased blood pressure. Correct answer: C. Prolonged reperfusion of the toes after blanching. Question 4 Explanation: Damage to blood vessels may decrease the circulatory perfusion of the toes. This would indicate the lack of blood supply to the extremity. If the intracompartmental pressure becomes higher than arterial pressure, a decrease in arterial inflow will also occur. The reduction of venous outflow and arterial inflow result in decreased oxygenation of tissues causing ischemia. If the deficit of oxygenation becomes high enough, irreversible necrosis may occur. Question 5. After a long leg cast is removed, the male client should: A. Cleanse the leg by scrubbing with a brisk motion. B. Put leg through full range of motion twice daily. C. Report any discomfort or stiffness to the physician. D. Elevate the leg when sitting for long periods of time. Correct answer: D. Elevate the leg when sitting for long periods of time. Question 5 Explanation: Elevation will help control the edema that usually occurs. Cleansing the leg should be done by patting the wet cloth to avoid injuring the dry skin. It is not unusual for the skin to have some changes: dry skin and more hair. A few baths in warm water will soak off the dry, flaky skin. This may take a few days, but be patient and avoid scrubbing the skin. Scrubbing may damage the new skin. Question 6. While performing a physical assessment of a male client with gout of the great toe, Nurse Vivian should assess for additional tophi, urate deposits, on the: A. buttocks. B. ears. C. face. D. abdomen. Correct answer: B. ears. Question 6 Explanation. Uric acid has a low solubility. It tends to precipitate and form deposits at various sites where blood flow is least active, including cartilaginous tissue such as the ears. Tophi, which are subcutaneous depositions of urate that form nodules, can also be found in patients with persistent hyperuricemia. Tophi typically occur in the joints, ears, finger pads, tendons, and bursa. Question 7. Nurse Katrina would recognize that the demonstration of crutch walking with tripod gait was understood when the client places weight on the A. Palms of the hands and axillary regions. B. Palms of the hand. C. Axillary regions. D. Feet, which are set apart. Correct answer, B. Palms of the hand. Question 7 Explanation. The palm should bear the client's weight to avoid damage to the nerves in the axilla. This is the most used technique. The left and right crutch along with the injured leg are both advanced while the uninjured leg supports the body weight. Next, the uninjured leg is advanced. Hand grips are part of each class of crutches. They serve as a significant connection between the crutch and the user. Hand grips have always been adjustable in the up, down, forward and back positioning depending on the crutch. Question 1. Karina, a client with myasthenia gravis, is to receive immunosuppressive therapy. The nurse understands that this therapy is effective because it A. Promotes the removal of antibodies that impair the transmission of impulses. B. Stimulates the production of acetylcholine at the neuromuscular junction. C. Decreases the production of autoantibodies that attack the acetylcholine receptors. Correct answer, A. Active joint flexion and extension. Question 8 Explanation. Active exercises, alternating extension, flexion, abduction, and adduction, mobilize exudates in the joints, relieves stiffness and pain. The role of exercising promoting the joint health of a person with RA is of great importance, especially as this is the most pronounced and invariant element of the RA disease pathology. Question 9. A male client has undergone spinal surgery. The nurse should A. Observe the client's bowel movement and voiding patterns. B. Log roll the client to prone position. C. Assess the client's feet for sensation and circulation. D. Encourage client to drink plenty of fluids. Correct answer, C. Assess the client's feet for sensation and circulation. Question 9 Explanation. Alteration in sensation and circulation indicates damage to the spinal cord. If these occur, notify the physician immediately. Assess movement and sensation of lower extremities and feet, lumbar, and hands or arms, cervical. Although some degree of sensory impairment is usually present, deterioration and changes may reflect development or resolution of spinal cord edema and inflammation of the tissues secondary to damage to motor nerve roots from surgical manipulation. Question 10. Marina with acute renal failure moves into the diuretic phase after 1 week of therapy. During this phase the client must be assessed for signs of developing A. Hypovolemia. B. Renal failure. C. Metabolic acidosis. D. Hyperkalemia. Correct answer, A. Hypovolemia. Question 10 Explanation. In the diuretic phase, fluid retained during the oliguric phase is excreted and may reach 3 to 5 liters daily. Hypovolemia may occur and fluid should be replaced. The diuretic stage usually lasts for 1 to 2 weeks but can persist longer. In this stage, an increase in urine output is noted and uremia begins to resolve as the kidney continues to heal. Question 11. Nurse Judith obtains a specimen of clear nasal drainage from a client with a head injury. Which of the following tests differentiates mucus from cerebrospinal fluid? CSF? A. Protein. B. Specific gravity. C. Glucose. D. Microorganism. Correct answer, C. Glucose. Question 11 Explanation. The constituents of CSF are similar to those of blood plasma. An examination for glucose content is done to determine whether a body fluid is a mucus or a CSF. A CSF normally contains glucose. A true normal range cannot be given for CSF glucose. As a general rule, CSF glucose is about 2/3 of the serum glucose measured during the preceding 2 to 4 hours in a normal adult. This ratio decreases with increasing serum glucose levels. CSF glucose levels generally do not go above 300 mg per deciliter. 16.7 millimoles per liter, regardless of serum levels. Question 12. A 22-year-old client suffered from his first tonic-clonic seizure. Upon awakening, the client asks the nurse, "What caused me to have a seizure?" Which of the following would the nurse include in the primary cause of tonic-clonic seizures in adults more than 20 years? A. Electrolyte imbalance. B. Head trauma. C. Epilepsy. D. Congenital defect. Correct answer, B. Head trauma. Question 12 Explanation. Trauma is one of the primary causes of brain damage and seizure activity in adults. Other common causes of seizure activity in adults include neoplasms, withdrawal from drugs and alcohol, and vascular disease. Common causes of emergency department visits after seizures are alcohol and drugs, head injury, and epilepsy. Correct answer, B. Palms of the hand. Question 7 Explanation. The palm should bear the client's weight to avoid damage to the nerves in the axilla. This is the most used technique. The left and right crutch along with the injured leg are both advanced while the uninjured leg supports the body. Correct answer, A. Pupil size and papillary response. Question 13 Explanation. It is crucial to monitor the pupil size and pupillary response to indicate changes around the cranial nerves. Pupil reactions are regulated by the oculomotor, 3, cranial nerve and are useful in determining whether the brainstem is intact. Pupil size inequality is determined by balance between parasympathetic and sympathetic innervation. Response to light reflects the combined function of the optic, 2, and oculomotor, 3, cranial nerves. Question 14. Nurse Linda is preparing a client with multiple sclerosis for discharge from the hospital to home. Which of the following instructions is most appropriate? A. Practice using the mechanical aids that you will need when future disabilities arise. B. Follow good health habits to change the course of the disease. C. Keep active, use stress reduction strategies, and avoid fatigue. D. You will need to accept the necessity for a quiet and inactive lifestyle. Correct answer, C. Keep active, use stress reduction strategies, and avoid fatigue. Question 14 Explanation. The nurse's most positive approach is to encourage the client with multiple sclerosis to stay active, use stress reduction techniques and avoid fatigue because it is important to support the immune system while remaining active. Recommend participation in groups involved in fitness or exercise and/or the Multiple Sclerosis Society. Can help the patient to stay motivated to remain active within the limits of the disability or condition. Group activities need to be selected carefully to meet the patient's needs and prevent discouragement or anxiety. Question 15. The nurse is aware the early indicator of hypoxia in the unconscious client is A. Cyanosis. B. Increased respirations. C. Hypertension. D. Restlessness. Correct answer, D. Restlessness. Question 15 Explanation. Restlessness is an early indicator of hypoxia. The nurse should suspect hypoxia in an unconscious client who suddenly becomes restless. When oxygen delivery is severely compromised, organ function will start to deteriorate. Neurologic manifestations include restlessness, headache, and confusion with moderate hypoxia. In severe cases, altered mentation and coma can occur, and if not corrected quickly may lead to death. Question 16. A client is experiencing spinal shock. Nurse Marina should expect the function of the bladder to be which of the following? A. Normal. B. Atonic. C. Spastic. D. Uncontrolled. Correct answer, A. Active joint flexion and extension. Question 8 Explanation. Active exercises, alternating extension, flexion, abduction, and adduction, mobilize exudates in the joints, relieves stiffness and pain. The role of exercising promoting the joint health of a person with RA is of great importance, especially as this is the most pronounced and invariant element of the RA disease pathology. Question 17. Which of the following stages is the carcinogen irreversible? A. Progression stage. B. Initiation stage. C. Regression stage. D. Promotion stage. Correct answer, A. Progression stage. Question 17 Explanation. Progression stage is the change of tumor from the pre-neoplastic state or low degree of malignancy to a fast-growing tumor that cannot be reversed. Tumor progression comprises the expression of the malignant phenotype and the tendency of malignant cells to acquire more aggressive characteristics over time. Also, metastasis may involve the ability of tumor cells to secrete proteases that allow invasion beyond the immediate primary tumor location. A prominent characteristic of the malignant phenotype is the propensity for genomic instability and uncontrolled growth. Question 18. Among the following components thorough pain assessment, which is the most significant? A. Effect. B. Cause. C. Causing factors. D. Intensity. Correct answer, D. Intensity. Question 18 Explanation. Intensity is the major indicative of severity of pain, and it is important for the evaluation of the treatment. Severity of pain may include the intensity graded by the patient or the impact pain has on function. Intensity may be assessed with certain scales that will be reviewed below. The impact on function may include changes with activities of daily living, activity level, and work-related duties. Pain may have an impact on sleep, mood, appetite, or social relationships. Question 19. A 65-year-old female is experiencing a flare-up of pruritus. Which of the client's actions could aggravate the cause of flare-ups? A. Sleeping in cool and humidified environment. B. Daily baths with fragrant soap. C. Using clothes made from 100% cotton. D. Increasing fluid intake. Correct answer, C. Glucose. Question 11. Explanation. The constituents of CSF are similar to those of blood plasma. An examination for glucose content is done to determine whether a body fluid is a mucus or a CSF. A CSF normally contains glucose. A true normal range cannot be given for CSF glucose. As a general rule, CSF glucose. Question 20. Thrombolytic therapy is frequently used in the treatment of suspected strokes. Which of the following is a significant complication associated with thrombolytic therapy? A. Air embolism. B. Cerebral hemorrhage. C. Expansion of the clot. D. Resolution of the clot. Correct answer, B. Airs. Question 6. Explanation. Uric acid has a low solubility. It tends to precipitate and form deposits at various sites where blood flow is least active, including cartilaginous tissue such as the ears. Tophi, which are subcutaneous depositions of urate that form nodules, can also be found in patients with persistent hyperuricemia. Tophi typically occur in the joints, ears, finger pads, tendons, and bursae. Question 21. An infant is brought to the clinic by his mother, who has noticed that he holds his head in an unusual position and always faces to one side. Which of the following is the most likely explanation? A. Torticollis, with shortening of the sternocleidomastoid muscle. B. Craniosynostosis, with premature closure of the cranial sutures. C. Plagiocephaly, with flattening of one side of the head. D. Hydrocephalus, with increased head size. Correct answer, A. Torticollis, with shortening of the sternocleidomastoid muscle. Question 21. Explanation. In torticollis, the sternocleidomastoid muscle is contracted, limiting range of motion of the neck and causing the chin to point to the opposing side. Torticollis or twisted neck, tortium column, of Italian origin torticoli is a vicious attitude of the head and neck, typically presenting with abnormal slope and rotation. There may be several presenting positions, including flexion, extension, right or left tilt. These have names such as horizontal torticollis, vertical, oblique, or torsion. Question 22. An adolescent brings a physician's note to school stating that he is not to participate in sports due to a diagnosis of Osgood-Schlatter disease. Which of the following statements about the disease is correct? A. The condition was caused by the student's competitive swimming schedule. B. The student will most likely require surgical intervention. C. The student experiences pain in the inferior aspect of the knee. D. The student is trying to avoid participation in physical education. Correct answer, C. The student experiences pain in the inferior aspect of the knee. Question 22. Explanation. Osgood-Schlatter disease occurs in adolescents in rapid growth phase when the infrapatellar ligament of the quadriceps muscle pulls on the tibial tubercle, causing pain and swelling in the inferior aspect of the knee. Osgood-Schlatter disease is commonly caused by activities that require repeated use of the quadriceps, including track and soccer. Correct answer, D. Elevate the leg when sitting for long periods of time. Question 5. Explanation. Elevation will help control the edema that usually occurs. Cleansing the leg should be done by patting a wet cloth to avoid injuring the dry skin. It is not unusual for the skin to have some changes, dry skin and more hair. Correct answer, D. Scoliosis. Question 23. Explanation. A check for scoliosis, a lateral deviation of the spine, is an important part of the routine adolescent exam. It is assessed by having the teen bent at the waist with arms dangling, while observing for lateral curvature and uneven rib level. Scoliosis is more common in female adolescents. Evaluation is generally a screening evaluation either through a school entity, sports coach, or pediatrician. The proper formal evaluation includes X-ray imaging. Correct answer, C. Decreases the production of autoantibodies that attack the acetylcholine receptors. Question 1 Explanation. Steroids decrease the body's immune response, thus decreasing the production of antibodies that attack the acetylcholine receptors at the neuromuscular junction. Immunotherapy is used to. Correct answer, C. Self-blame for the injury to the child. Question 24 Explanation. The profile of a parent at risk of abusive behavior includes a tendency to blame the child or others for the injury sustained. The child may also be perceived by the parents as an extension of self. The parent's lack of self-esteem and negative self-image may be projected onto the child as well. The child becomes a scapegoat and is made to pay for the parent's sense of inadequacy and failure. Question 25. A nurse in the emergency department is observing a 4-year-old child for signs of increased intracranial pressure after a fall from a bicycle, resulting in head trauma. Which of the following signs or symptoms would be cause for concern? A. Bulging anterior fontanelle. B. Repeated vomiting. C. Signs of sleepiness at 10 p.m. D. Inability to read short words from a distance of 18 inches. Correct answer, B. Repeated vomiting. Question 25 Explanation. Increased pressure caused by bleeding or swelling within the skull can damage delicate brain tissue and may become life-threatening. Repeated vomiting can be an early sign of pressure as the vomit center within the medulla is stimulated. Clinical suspicion for intracranial hypertension should be raised if a patient presents with the following signs and symptoms: headaches, vomiting, and altered mental status varying from drowsiness to coma.